Of the 5 gynaecological cancers, endometrial cancer is the most common, and it's important to know the signs and symptoms. These are abnormal bleeding between periods or after sex or postmenopausally, and it's very important to go to your GP as soon as you experience these symptoms to get checked out. Ovarian cancer is the 6th most common cancer, with over 7,000 women diagnosed every year. It's a difficult one to detect because the signs and symptoms are a little bit vague and varied, and they include increased bloating and abdomen feeling full, changes in and habits in bowel movements, possible vaginal pain and discomfort, persistent abdominal and pelvic pain.
Vaginal cancer is the rarest of the 5 gynae cancers. It's most prevalent in women who are over 60, and about 250 women are diagnosed every year in the UK. The symptoms are unusual discharge, so that's different for everybody, but it's a discharge that's a little bit foul smelling or an unusual colour. Whatever you think is abnormal for you is worth going to get checked out by your doctor. It's also really important to check your vagina. Pop a finger or 2 inside and feel around and feel what your vagina feels like on a normal day. Do it regularly, perhaps once every couple of weeks, and if you notice a lump or anything that feels, again, abnormal for you, just go to a doctor, because it is so much better to be safe than sorry. Vulval cancer is the 2nd rarest of the gynae cancers, with around 1,300 cases diagnosed every year in the UK. Again, like with vaginal cancer, it's more prevalent in older ladies, but of course that doesn't mean that us younger girls don't need to check ourselves. So the main symptoms for vulval cancer are a change in the skin colour of your vulva, so around the labia and the clitoris. If there's an unusual itch, unusual skin, so perhaps a patch of dry skin, and any lumps and bumps that aren't kind of an ingrown hair or anything that feels abnormal for you. Rub your labia between your fingers and see what the skin feels like, and then if there are any lumps and bumps, again, anything unusual for you, just go to the doctor, because your doctor, I promise, would much rather say, that's just an ingrown hair, than tell you some awful news.
Cervical cancer isn't that common. It affects about 3,500 women a year, but in an age group of about 30 to 45, it's most common, which is quite young for a lot of the cancers. So the most common type of cervical cancer is squamous cell cancer, and it's predominantly caused by a virus called human papillomavirus. So it's very common for people who are sexually active, not necessarily have had sex, but to have sexual contact, to develop HPV. 80% of the population will have HPV through sexual contact. If HPV is left untreated, it can go back to being normal if your body's strong enough to fight it. However, if it is left untreated, it can go on to develop into a cancer, which is why really you should be going for your smears, because we pick up abnormal cells before they turn to a cancer. So the signs and symptoms of cervical cancer are usually often postcoital bleeding, irregular bleeding, bleeding between your periods, or in older women, if you've stopped your periods, it could be bleeding after your periods have stopped, so postmenopausal bleeding. Other signs can be discomfort when you're having sex. So not your normal discharge, because we all have a normal smell to our discharge, but offensive smelly discharge, pain and discomfort. And sometimes people present with a urine infection, which maybe isn't a urine infection. But all of these things can be non-cancerous. It doesn't mean it is going to be cancer, it's just worth getting it checked.